Hey guys, what's up? So I'm just a couple days past my 2 months post-op, so I figured I'd make a video, show an update on my chest, and go a little bit over my range of motion, my scar treatment, and just my overall well-being. So I'll give you a close-up of my chest. Everything looks really good. I've seen some other guys around the same time frame, and I think my scars are quite thin still, so I've been really careful about overhead reaching, so I've been limiting that as much as possible. If I have to reach something, I kind of push up the skin under my scar, so it's not just pulling the skin with it, it's kind of helping it up. And that also just makes me feel more safe about having to reach something, but if I don't absolutely need to, I'll use a stool or some other way of getting it. Other than that, my range of motion is really good. I can reach in all directions with really no limits whatsoever. So the nipple grafts, I think I talked about in my last video, they're still lacking quite a bit of pigment. So they're very light pink, but they're in pretty good shape. Like the scabs, I actually didn't do the best. I kind of helped the scabs come off, i.e. I kind of picked them off. But there wasn't really any issue. They were just on for like a really long time, like a couple weeks longer than I thought they probably should have been. So I just kind of picked at them a little bit, and anyway, they came off. So I was gonna go through my scar care regime a little bit. So I talked about in my last video the silicone strips that I've been using. So I'll use Mepiform silicone strips. I'll shower in the morning and put them on. So I do that once a week. So I only put them on once a week. I leave them on 24 hours a day for an entire week. And then when it's time to take them off, I'll get home from work, I'll take off the strips, I'll do an oil massage using two different types of oil. So there's rosehip oil and tamanu oil. Both of these I got on Amazon, and they were both off different trans guy websites about good oil to use on your scars. They're both cold pressed organic oil, so they're very high quality, which is a good idea, especially if you're going to be putting it directly on your body, you know, your exposed skin. So that's been going really well. It probably sounds kind of weird, but it's very therapeutic to do it. Like, you feel very connected with your body when you're going over the incision, and I find it very calming. What else? Oh, I want to talk a little bit more about some things earlier in my recovery that I didn't touch upon in my last video. Driving, for example, I waited pretty much as long as possible until I had to drive, only because, again, it's just another movement that could cause stretching to your incisions. So I think Garramone clears you for driving after 2 weeks, and I actually waited 4 weeks. So at the 4-week mark, my hair was just getting super long, and I really wanted a haircut. So I was like, all right, it's probably a good time for me to try driving. And it was fine. And even the only thing now, I'm about 2 months of 9 weeks post-op now. So I've been driving for 5 weeks, and on my left side, it's weird. The left side in general is, I have much more mobility on my left side, and the scar is thinner, which is really surprising, whereas the right side, I'm right-handed, is stretched a little bit, I mean tiny bit, but in this little area is slightly wider than anywhere else on the scars. But my right side, I feel quite a bit more limited, so even in driving, my right side, it's still quite difficult to go all the way around. Like, I can do it, but I can feel a bit of pulling, so when I make those turns, I kind of just do lots of little steering motions from the bottom of the wheel. So I don't know, everyone heals differently. I haven't even gone back to the gym to do any kind of lifting yet, which is driving me a little crazy because I'm not used to being in the house this much without much activity. But again, you know, you're cleared at 6 weeks, so I could have gone back 3 weeks ago, but I just want to really make sure that my scars are well taken care of, because, you know, the gym is always going to be there. We only get to recover once. So, you know, if you stretch your scars, they're stretched. Like, unless you have surgery or something to correct them, they're not going to go back. So why not wait, you know, a few months, a year sounds dramatic, but you know, a few months, a year for your scars to be completely healed, and then go back to your day-to-day. So yeah, I don't know. I don't have a whole lot more to talk about. I think one other benefit of the silicone strips, and not too many people mention, is that because they're directly on the scars, it's just another layer of protection against the sun. So obviously you want to keep your scars out of direct sun exposure for the first year to prevent hyperpigmentation, or basically permanent burning of the scar. So if you have just a t-shirt on, it's about 10 SPF, but if you have the scar strips on and a t-shirt, it's about 30 SPF. So there isn't a need to put on sunscreen. And a lot of people think that the stronger SPF, the sunscreen, the better. And that's true, but it caps out at like 35. Like if you get 35 versus 100 SPF, there's no difference. It's just marketing at that point. So and the thing with sunscreen is only effective for 90 minutes. So if you wanted to really be diligent about that, you'd have to be applying it over every hour and a half. Whereas the strips, you put them on. I literally leave them for an entire week. I don't change them when I shower. So I'll change them once a week, do all the oil stuff, and yeah, they like never ever see the sun. So I think they're gonna fade up pretty well. And it's super early. It's only two months in, and I mean they're pinkish red, but they're not very dark. They're really flat. There's absolutely no areas of keloiding or raised scars. Again, the silicone tape helps with that. It makes sure that they heal in like a normal formation, is what the website said. So yeah, just do your research. But silicone is absolutely your best bet. I personally would advise against ScarGuard, which is what Garramone recommends, only because it has vitamin E in it. A lot of research has been done that there's absolutely no conclusive evidence of vitamin E being beneficial for scars. It can actually make your skin stretch, which is really the opposite of what you want to happen. And it can also cause dermatitis, which is a skin condition that, you know, causes a breakout, I think, along with scars. So overall, I personally wouldn't recommend that. I mean, I don't know if Garramone has a reason that he recommends it, but I purposefully didn't buy it. And I've been using the strips for 7 weeks. So literally as soon as I was able to take the tape off from his office, I've been using the strips. So I think that's going to be the best thing for you. I plan on using them for about 6 months to a year. Again, for the sun exposure, if nothing else. I think they work for about 6 months. I think beyond 6 months, they don't have too much of an impact on the aesthetic of the scar, but the sun exposure is a good plus, the fact that they really limit that. So yeah, that's pretty much it. I'll turn to the side. Everything's really flat. I still have a little bit of swelling in the middle, but it's definitely gone down over the past few weeks. So I'm very happy. Like I said, nothing's changed on that end. So if you have any questions, hit me up in the comments, or yeah, just let me know and I'll try to help the best I can. Alright, thank you.